ke? Okay. I call you today to explain about the management and care of for patient with complication. So kat rumah you maybe have the complication. Tak kisahlah dekat rumah ataupun dekat outside. Contoh you pergi bercuti ke kan. So kita akan give the abnormal symptom at home or somewhere you been. So first, if you see the bleeding at the catheter site, so what you have to do? So first, at home, if you have the bleeding at the catheter site, please give the pressure at the catheter site with the clean gauze and come to CAPD unit immediately. Okay, so in CAPD unit, we can go to further management with the prescribed by doctor. So at the hospital, we change the dressing and monitor the leakage or bleeding at the exit site. So please keep the transfer set in the PD belt and please elak daripada tertarik because bila dia tertarik dia akan bagi injury dekat bahagian exit site and can be more bleeding at the site. So please use the clothes not tight. Use the longgar clothes. Tight clothes, it can give the pressure at the site. So if have the fresh blood and not stop, we decide to doctor and go to next investigation. So you have the bleeding at the exit site at home. I see you punya exit site clean and good. You must do the daily dressing kan. On the morning, please after you bath, please do the daily dressing. Don't forget So next is a peritonitis. Peritonitis is the infection in the peritoneal. So first you know the peritonitis, you punya fluid came out with the cloudy color. So it called as a peritonitis. It is so dangerous. It can be membawa maut. So kalau kita tak treat. So sign and symptom as dia punya sign and symptom of peritonitis is a fluid, cloudy, abdominal pain, fever and diarrhea. Or you can you punya body weak, so you tengok je fluid dekat bawah tu dah cloudy, so dia ada peritonitis. So if you have the peritonitis, please bring the cloudy fluid back to the CAPD unit. If you've been the hospital, we take the sample and send for FME and culture specimen. Flush the 3 bags of the dialysate into your peritoneal membrane to flush out the infection, and we inflow the intraperitoneal antibiotic to reduce the infection. So the IP antibiotic must be take 21 days. So as a prescribed. So please restrict fluid because if you have the peritonitis, your membrane must be changed status because of the infection. So after you clean you recover from infection, we must do to retraining you as you punya teknik, you punya hand wash, cara you dressing about exit site. So cara you connect the tubing is correct or not. So we monitor the exit site infection. Kadang-kadang dia punya exit site tu boleh menyebabkan peritonitis, sebab dia akan bermula pada luar dahulu, dia akan masuk ke dalam dan akan infection dekat bahagian dan fluid. Dia akan ambil masa lama baru benda tu datang. Keep check the bag. If have the bocor, please bath every day, change your clothes every day for minimize the infection. And please wash your hand before touch your catheter or exit site. During the dressing, you must use the antibiotic, and please do not move or interrupt your catheter. Next is internal bleeding. So internal bleeding adalah pendarahan di dalam intraperitoneal kita lah. So if you have the menses, the fluid color can be the red color. So you don't panic, because mesti you pernah kena kan, masa you menses you ada rakyat, you ada cold eye, so you kata ni you ada cold, so you punya fluid tu ada after 2 to 3 days the fluid becomes clear. So please do not take the heavy angkat berat lah, ataupun exercise yang berat. Dia akan maybe injured dekat tiny vessel dekat dalam peritoneal tu. So internal bleeding can be if patient have the blood clot during CAPD or treatment. So during well pun boleh jadi blood clot, so must be monitor. So if have the sign and symptom, please call and bagi tahu lah. Dehydration is kekurangan air dalam badan. So as we know, you do the dialysis, you must restrict the fluid, monitor the blood pressure. If low, you must be weak. If high, you must inform, and we can monitor your weight or your blood pressure. So if you punya blood pressure 100 above below, must be dehydrate. So please, if you dehydrate, use the oil low glucose 1.5%, because if you use the high concentration glucose, maybe extract more fluid into your body. So use oil 1.5 will reduce your DF. So please monitor your both legs and skin tegel. So if you get the dehydration, your kaki was so kering, but please inform if you get worse dehydration. Come to hospital immediately. Please monitor your weight, your edema at your face and your kaki. If you increase your weight, your edema must be worse. Okay, so second is sign and symptom, short of breath. Okay, so if you have this short of breath, you must restrict your fluid and restrict your sodium intake. If you take a lot of sodium intake, your fluid still retain in your body, and your edema is become worse and worse and worse. So if you come here with edema, we can use the rapid exchange, use the 4.25. So rapid exchange is we in out the high concentration glucose to reduce your edema. So high concentration glucose we just have at the hospital, and we do as prescribed by doctor. So at home, if you have edema, please use 2.5 and okay, please use 2.5 and record your end of my session today. So I will give you the pamphlet as usual. Please, if you have any problems at home, contact me and come to CFPD unit immediately. Okay.